Services. My name is Ann Lindy, and I work at the Minnesota Department of Health. So this session has 2 American Sign Language interpreters. I believe they will be taking turns. So I think there are instructions in the chat for how to be sure you can see both the interpreters and the slides at the same time. Maybe I'll pause for just a moment and make sure everyone is able to see the interpreter and the slides. Anyone having any trouble with that? And just to note that this session is being recorded and it will be captioned and posted on the Request for Services webpage. And instead of saying request for services a million times in the next several minutes, we'll just call it the RFS. Next slide, please. Thanks, Romeo. Okay, so who we are. This request for services is being issued by the Minnesota Department of Health, MDH. And MDH has created special teams to work on various aspects of our COVID-19 response. And these contracts will be part of the work of the MDH COVID-19 Cultural, Faith, and Disability Communities branch. So this branch is led by Danushka Wanderagala, and I'm the deputy. Chelsea Huntley is the chief of the entire section, Local Tribal Community Health Partners section, which includes our branch. And then within the branch, we have a contracts team led by Bridget Palladian with Meredith Algren as deputy. And the contracts team has about 20 other staff members, many of whom are the contract managers who will be working closely with our funded contractors. Next slide, please. Okay, so here's our agenda for our today. Today we'll mostly be walking you through the key parts of the RFS, giving you an overview here, giving you a chance to ask questions. If you do have questions as we present, please feel free to type them into the chat bar on your screen. We'll compile them as they come through, and at the end we'll answer the ones that we have time for. And all questions that are submitted, whether we have time to answer them during this webinar or not, will be posted to the website with responses. So you'll get your answer either way. Okay, next slide, please. Thank you. Yeah, so here's the web page for our diverse media RFS. And next slide, please. Okay, yeah. Again, this is our COVID-19 diverse media request for services, and we're requesting contractors to aid us in disseminating culturally relevant, linguistically appropriate, accurate, and timely messages related to COVID-19 vaccines. It's going to be a hot topic in 2021, testing, and other important COVID topics. Our primary audiences are communities of color, American Indian communities, LGBTQ communities, and disability communities in Minnesota. Media services may include formats such as online and social media, radio, TV, and print. And we do encourage vendors to use methods that are adaptable to quickly changing information. Next slide, please. So again, the primary audience must include one or more of the following communities within Minnesota: African American, African immigrant, American Indian, Asian American, disability communities, Latinx, or LGBTQ communities. And vendors are encouraged to reach diverse communities within communities of color and American Indian communities, such as people of color and American Indians with disabilities, and people of color and American Indians who are LGBTQ. So the contractors will be chosen through a competitive review of proposals by a panel that will include MDH staff, other state agency staff, and community partners. And our selected contractors will reach those major communities that we've been talking about and cover a range of communication modalities and geographic areas. So really trying with our full cohort of contractors to have good reach in our communities and our regions across the state. And priority will be given in scoring the proposals to media entities that are owned by people of color, American Indians, LGBTQ individuals, and or individuals with disabilities. So here are some important dates for you to keep in mind. The RFS was released on Monday, the 14th. The deadline for you to submit questions is December 22nd by 5 p.m. And that's so that we have a chance to respond to those questions and post them to the webpage so that everyone has access to the same information before the deadline of December 28th, when proposals are due by 11:59 p.m. And we anticipate that these contracts will start in early February and they end on July 31st of next year. So the goal of this project is that everyone residing in Minnesota and the tribal nations that share its geography, including residents from communities of color, American Indian residents, LGBTQ residents, residents with disabilities, and residents with limited English proficiency, have the opportunity to be fully informed with culturally relevant, linguistically appropriate, accurate, and timely messages related to COVID-19 vaccines, testing, and other important topics around COVID-19. So this RFS is contingent on funding availability. We expect to have $1.5 million available for multiple media contracts through this process. And we seek proposals in the categories below, depending upon the audiences reached, the type of media, and the depth and frequency of reach. We're looking for proposals for less than $50,000. Maybe those will reach a single, cultural community or use less frequent communication methods. Or proposals between $50,000 and $150,000, which could reach multiple communities or use multiple communication methods on a more frequent basis. And this request for services is intended for media vendors, so entities whose primary focus is providing media services. Okay, so some of the responsibilities for contractors here, some sample tasks. Contractors will work with MDH to finalize their communication plan, which will include same-day turnaround in many cases, for cultural adaptation, translation as needed. So it could be things like radio or TV interviews, paid advertising, or social media. Contractors will be asked to participate in media briefings that the state leads, and again, adapt timely messages to your communications modalities, disseminate those messages, and prepare brief reports on your contract progress. Okay, now we'll talk about the requirements for responding to this RFS. So interested responders should please complete the proposal submission form that's found on the Diverse Media RFS webpage. You'll receive an automated confirmation email, and please reply to that email and attach your supplemental materials. And it's important to note that not only your proposal submission form, but also all of your supplemental materials must be received by that deadline of 11:59 p.m. on December 28th. So again, you must submit the following for your application to be considered complete: your proposal submission form and your supplemental materials. The supplemental materials are your work plan and budget. We'll talk more about them in a minute. And 1 or 2 examples of previous work. Okay, so this online proposal submission form, it's pretty brief. We hope it's not intimidating. Hope it's relatively easy for you to complete. Again, please go to the web page to complete it. It asks for information about the communities that you intend to reach, the media formats you'll be using, and how frequently you'll be getting messages out to your communities. Your history and experience related to your proposed plan, the cost of the services you're proposing, and the estimated number of people reached and number of media messages per person that you're proposing. And again, after you submit this form, you'll receive an automated confirmation email, and you'll reply to that email and attach your supplemental materials. Okay, so one of your supplemental materials is your work plan and budget. We strongly encourage you to use the template that's available there on the web page. Again, it's pretty simple. Hopefully it won't be too challenging, too onerous for you to complete. You'll list your, the activities that you're proposing, frequency, the reach. There's a tab 2 in this template that gives some examples, quite a few examples actually, of how you can complete this. And please do note that all of your expenses, so including your staff time, any administrative costs, things like that, should be factored into the unit cost for each deliverable. So there are no other special line items for those kinds of things. Everything is a media deliverable and all of its associated costs. If you do use a different format, again, we strongly encourage you to use the template that we've provided, but if you do use a different format, it must include the following. So again, overview of the formats you're going to be using, description of each activity, whether you're creating, adapting, or disseminating the content, the timeline for each activity, including the estimated turnaround time for adapting or translating or publishing messages, the partners involved in each activity, if applicable, the number of media messages per media format, the estimated audience reached per message, and the estimated cost per deliverable. And the other piece we're asking you to submit as one of your supplemental materials is 1 or 2 examples of your previous work. And here we'd really like to ask you to provide links to those examples as much as possible. It's much easier for everyone. If your content is not available to link to online, please limit file size to 2 megabytes? 2 MB. And please do not send more than 2 examples of work. We can't consider more than 2 examples. And again, after you submit your online proposal submission form, you'll get an automated confirmation email. That's what you'll reply to with your work plan and budget and your 1 or 2 examples of past work. But if you don't receive that automated confirmation email within 1 hour of submitting your form, please do check your spam folders, your junk folders. If you don't receive it, please email your supplemental materials to this address here, health.covidmedia.mdh@state.mn.us. And please indicate in your email that you submitted the online form but did not receive a confirmation email. And again, I'll remind all of your materials, submission form and supplemental materials, must be received by 11:59 p.m. on December 28th. About the RFS, about the form, the templates, any other aspects of the process, please email that same email address, the health.covidmedia.mdh@state.mn.us email address, and MDH staff will get back to you within 1 business day. And we do ask you to please submit your questions by 5 p.m. on December 22nd so that we can share our answers with everyone before the deadline. And all responses to questions will be on the Diverse Media RFS FAQ page, and there's a link to it there. Please also do review the standard state PT contract template. There's a link here. This document sets forth the state's standard terms, insurance requirements, procurement laws, other requirements that may apply in the event that you get a contract with the state. Yeah, so in terms of our proposal review and selection process, as I mentioned, the review committee will be comprised of external partners and MDH staff, and we're really trying hard to make sure that our review committee has good representation from all of the priority communities that we're trying to serve through this request for services. The review committee will review complete responses. So again, those that have included both the online form and the supplemental materials and that were submitted on time. After the deadline, if MDH concludes that we're lacking proposals reaching one of our priority communities, the submission process may be reopened and submissions would be reviewed on a rolling basis until funds were used. But please don't count on that. We anticipate a good response. So please try to get your materials in by December 28th. And proposals will be scored using a numerical scoring system out of 100 points. The review committee will be looking for alignment with the state's needs to reach all communities of color, American Indian communities, disability communities, and LGBTQ communities in Minnesota. They'll be looking at your proposed plan, your history and experience and relevant qualifications. Also, that crucial question of ownership or leadership and operation by people of color, American Indians, individuals with disabilities and/or LGBTQ individuals, and the cost of your proposal. And also, we want to mention that new partners and past contractors in the COVID response are both encouraged to apply. If a responder has been a previous contractor, their past performance as a contractor will be considered. Yeah, so now I think we are ready to open it up for questions.
Great, thank you so much, Anne. We have a couple questions that have come in the chat so far, so I will read those out, and I've answered those as well in the chat. One question was, if a contractor received funding from the previous 2 COVID-19 requests for services and executed all elements successfully, and similar projects would apply to this RFS, is there any reason we shouldn't include programs or projects we did for the previous RFS? And the answer that I posted in the chat is that applicants can certainly propose repeating or building on activities that they've successfully executed in prior contracts. Another question was, do you have any generic messages or content prepared for this RFS? And the answer that I posted is the state has some ready-to-go messages already available on our website and on the governor's COVID-19 website, such as masks, social distancing, and testing messages. But there will also be many timely messages coming out as the situation evolves and those messages are developed, such as timely vaccine messaging that we will be sharing with those funded through this contract to then share out with communities. Let me just take a moment here and see if there are any other questions that have come in the chat. One other question was about the slides, and the slides will be posted on the website as soon as they are made accessible. I think that's all the questions I'm seeing in the chat. Please feel free to add any other questions in the chat or unmute yourself and ask your question if you have one.
Hello, I have a question. Hello.
Yes, go ahead. Go ahead.
When this forum started earlier this year, I was invited, and I think I've attended twice or so, and we were asked to fill a form as people of color, and reaching out to our people here in Minnesota, and we've done that, and we've not got replied, and all of a sudden I've not been receiving the link for the Tuesday meeting, Zoom meeting. So I don't know. So when I got this, and I said it's important that I come over to share this. In fact, within our community, as a church community, we've been trying our best. We have quite a number of our people that are contracted with this disease. We have to struggle in spite of challenges that we, the people of color, are facing here. So I felt, I don't know why we're not reached out to, and so that's my question. So with that, in fact, when I got this information, I talked to the lady, and they applied the other one. Nothing has been done. And how do we know that we can be helped at this time?
Yeah, thank you. Thank you for your question. Let's see, if everyone could mute if you're not speaking, please. Let's see, so if I'm understanding the question, I think it is that maybe you have applied in past rounds. We've issued some other requests for services in the past. And yeah, we have had such an overwhelming response to our requests for services, and so many, worthy media vendors and community-based organizations for our community engagement requests for services have applied. We have really wished that we could fund many more of the applicants. But yeah, we encourage you to apply this time, and we certainly wish you the best. Yeah, very, very important points you are making about how communities are really being devastated by COVID, and we are grateful to our partners for their work in communities, whether they are funded through this request or not.
I have a question.
Yes, go ahead.
My question is, from my experience as a member of East African community, there are diverse communities within the East African community, such as Oromo, Somali, Ethiopians, Eritreans, and also many other minor communities. But as far as my experience goes, in Minnesota, it seems that they just bundle up everything together and they assume that everybody is Somali. So what are you guys doing in particular to address this diversity within the East African community? I had a meeting last week with the Ramsey County Health Department, and that is what I tried to bring to their attention. And they also told me that there is a problem of bundling up everything as a Hmong in the Ramsey County, Hmong, Karen. They are all often mixed up. And also what I see is there is this approach of one size fits all solution. Whatever intervention they use for Somali seems to be applicable for Oromo, while in fact, Oromos has got their own diversities and their own experiences. So what are you guys doing in particular to address the diversity that exists within the East African communities and the diversity that exists within the migrant community within the state of Minnesota? That is my question.
Yeah, thank you. I will be happy to take a first crack at answering your question, and I would invite my colleagues to respond as well. So again, very important points, and we have been fortunate to work with community partners and fund a number of contractors over the past, several months, if we're talking about the COVID response, who have represented some of the diversity in our African communities, in our Asian and Pacific Islander communities. We have worked with Oromo serving organizations, Ethiopian organizations, West African serving organizations, and we certainly, expect to do that for this round as well. And I think your point about the need for customized responses, right? Culturally specific responses. I think that's where we certainly look to our partners and our contractors to help us, design some of those solutions. In our community engagement request for services, which was issued at the same time, we're asking our contractors to share back with us their learnings from their communities, what they're hearing, and kind of co-create responses and solutions with us. So definitely looking in your work plans for responses, activities that you think are going to be most helpful and relevant to your communities. I don't know if anyone else from the MDH team would like to add anything, but thank you. Very good questions.
I have one more question. Maybe this one is going to be the last one.
Sure, please go ahead.
My question is, most of the intervention method and techniques focuses on written statement whenever they talk about this message that need to get across to different communities in the Horn of Africa, where my experience comes from. They seems to be the county or the state is relying on translations, whereas, for example, if you take like the Oromo from where I come, and many of the East African languages, maybe except Somali and Amharic, the written system started some 15, 20 years ago. So most of the people who are in the high risk bracket, the senior citizens, they don't have any experience of reading in their native language. So what are we doing in particular to address the need of these communities who are more of who comes from the culture of oral tradition? I mean, not for particularly for this one, but for all the intervention you guys are doing at the level of the state and counties.
Sure, yeah. Well, so I think for the purposes of this info session, we probably will focus, on what we're asking for with these contracts, but would love to continue the conversation more broadly in another setting. But yes, we certainly welcome media vendors to propose videos, TV shows, interviews, radio programs, a variety of communications that aren't print, right? That don't depend on reading a written language. So thank you.
You're welcome.
I see another question in the chat here. When you say contractors are limited to 2 supporting materials, does that include materials indicating past work attached to the proposal? And the answer is yes. Please only include 1 to 2 examples of past work with your proposal. So you'll have it in your attachments, you'll have your work plan and budget, and then you'll have up to 2 examples of past work. And then a follow-up question to a question earlier about generic messages or creating content. Are contractors able to use generic messages as well as create new content? And I would say yes. In general, our contractors do a mix of using, and instead of generic, I'll say maybe timeless messages. The messages about continuing to wear a mask, those have been messages that we've been continuing for months now, as well as when there's new timely information, then we will rely on our contractors to get out those new messages and focus on those new messages.
Yeah, and I see a question here. If a prior application, for our diverse media contracts has been denied, what is the likelihood of being approved if reapplying? And again, would just reiterate that we had so many outstanding applications for our past rounds that we would really encourage you to apply again because just because we did not have nearly enough funding to go around does not mean that your application was not excellent and would not be strongly considered this time around.
Can I have a follow-up with that? I asked that question. So I'm wondering if the review or people who are reviewing through the community or MDH are the same equal people who reviewed the prior application, sort of what difference do we have to make a difference or differentiate so we don't have to get the same denial again?
Yeah. Well, I would say that the review committee will be different this time around. There may be some of the same reviewers, but it is a new review committee this time around. And I would just encourage you to really look at the scoring criteria that will be used. Really consider those application questions. Do your best, to answer them, again, with those scoring criteria in mind. Providing really good examples of work that you've done in the past, both in describing your work, in that online application form, and in the 1 or 2 examples that you choose to submit to us. And really putting together a great work plan and budget, right? That's going to be key too. Showing good reach within your communities, well-defined communities, and strong expertise in the media methods, that you're choosing to use. I think those would be some of my words of advice, but yeah.
Thank you.
Thanks. And that ties in really nicely to another question, any advice that you can give to first-time applicants. And I think everything that you just said applies. I just would highlight that we posted on the Request for Services webpage a link to the scoring sheet that will be used. So I would recommend that as you write your application, you review that to make sure that you are demonstrating, how your organization has developed trust with your audience, how your proposal will effectively reach your audience, and then also making sure that your budget request is commensurate with your work plan and the reach that your media organization has in the community. I also see a question about in the January lapse, what is the plan to continue to communicate to our communities on the vaccine? This is a really, really great question, one that we're continuing to try to address at MDH. We currently, as you probably have seen, this request for proposals is contingent on us receiving funding. So ideally, we would have already had this funding months ago, and we would have already had our contractors selected, and you'd be starting on January 1st, and there would be no gap. But because of circumstances outside our control and the fact that MDH still has not received this funding, there will be a gap in our contracts. But we are working hard to make sure that we still are able to collaborate with our many, many partners to get important vaccine messaging out. And I don't think I have any more details that I can share at this point. I can just assure you that, right after this, we have another meeting with some folks to work on that plan. So, but I'll open it up and see if Anne has anything else to add.
I think that was a good response, Bridget. And then I see a question about, we did apply last time, believed, that we had a strong application, but were denied and no reason was given. And feeling as though, they were as qualified as some of the contractors that were awarded. So just want to say that applicants are always welcome to reach out to us to receive information about what the review committee said with respect to their application, what their score was, and what reviewer comments were. So if that would be helpful to you as you're applying this time around, it's that same email address that's listed in the slides here, that COVID media email address. You can email that to ask for feedback on your previous application. And again, just really want to empathize. I know that our review committee and our MDH staff were just really, really wishing that we could have funded many more media vendors and community engagement contractors last time around. I have a feeling it will be the same this time, although I'm glad that we have a good funding amount here to offer this time.
Are there any other questions that we've missed? And please feel free to unmute yourself and ask your question if we have.
Hello, can you hear me?
Yep.
So you did talk about contractors. What if we own sort of a TV and radio station? Can we apply that directly?
Yes. Is the question whether a TV or radio station company can apply directly?
Correct.
Yes, absolutely.
Okay, thank you.
One more question. Sidora.
Yes. So my question is, we do have KLY radio, and the early question someone asked, they said, how you guys communicate old generation and the younger generation? We have bilingual, like we speak Somali, we speak in Arabic, we speak in English. So we have a lot of programs. This is the only KLY radio, is the only one FM radio in Minneapolis or Twin City, 24/7. So how can we make sure you guys know about the really radio or the media connected to community, and not a lot of media work only online, but the radio and the media working with their cars, their home, people who want to reach. If I share with you one thing, last year we had missile broke down in the Somali community, and 87 Somali kids got missile. And we've invited Somali doctors, we invited Somali nurses, and 3 months MTH and Kelly Radio, we did great work. So how can we do similar like that in the future?
Did you guys hear the question?
Yeah, I think so for the most part. So yeah, thank you for your outstanding work. I believe you're talking about KALY Radio. Yes, definitely a strong community partner. So I think the question was, how can you be sure that MDH and the review committee will know about your full reach? And so again, please take every opportunity in the application process, both in your submission form, in your work plan, and in your supplemental materials, you know, your examples of past work that you've done. Please take every opportunity to let the review committee know just how extensive your reach is, what you've done in the past, including past work you've done in partnership with MDH, if you've done that. So yeah, please know that the review committee needs to see it in your application, right? So it'll be essential that you communicate it through those different questions and materials. So thank you.
Thank you.
And there was a question about whether individuals could apply for the funding, and the answer is no. Media vendors or organizations are the eligible applicants for this funding opportunity.
Yeah, any other questions from folks? Okay, well then we really want to thank you all again for joining us, for your interest in this opportunity, and we look forward to receiving your applications. Again, the slides and recording will be posted on the web as soon as they are made accessible. And you are always welcome to submit questions to that COVID media email address, and we'll respond within 1 business day. All the answers to all of the questions will be posted on that FAQ webpage. So thank you all very much. Have a good rest of your afternoon here.